Thank you very, very much. So yes, I started my work with Ulster County as the project manager for the Healing Community Study. And so with that study, we were really able to take a community-driven approach to addressing the opioid epidemic in Ulster County. We took feedback, we did all types of analysis of the landscape, of the services that were available, and we looked for gaps, and we looked for ways to address those gaps in evidence-based practices. So with this work, this is really what brought me here to this place with the sheriff and lieutenant in designing what is now, for all of you, our redesigned Oracle team. So our new team, our Oracle team now, with our very first grant, we were able to add a social worker, 2 peers, and a CIT officer for again, a very community-led response to opioid overdose. So this was our opioid overdose response team. The second grant allowed us to also offer more services by including 2 care managers, one specifically for the community, and one for our reentry, our jail reentry. So through this work, we were able to truly not only expand the work that expand with what the sheriff's office was already doing, but we were able to better connect and reach individuals who might not have been reached prior. Not only connect to them, but connect them to the resources that we have in our amazing community. And so with that said, we could talk a little bit about the numbers. So the Oracle stats, and I'm talking about Oracle right now because this really is what led us to where we are today. We learned a lot. So through Oracle, we had about 648 referrals in 2022, not about, we had exactly. 600 of those individuals consented to peer services. So that means that they actually consented to have peer services, have individuals on our team maintain connection and follow up, and whether on our team or in the community. So that's huge. That's the majority of the individuals that we made contact with. And from that, more than half of them were referred to rehab or detox. You know, and these are individuals that are the highest risk of overdose fatality in our community, and our team has been able to go out and make these connections. And we started to learn what the true needs were from the community, because as they're going out and connecting with individuals, they're understanding the nature of the overdose, they're understanding the epidemiology behind the situation. And we began to truly connect the dots. And so this year, we started to track the data regarding nature of overdose. And so when I say nature of overdose, it's intentional versus non-intentional overdose. And so what we learned was about 28% of the overdoses were deemed intentional, meaning that the individual had taken whatever substance very specifically with the intent to harm self. And there's only 2 ways of determining this. One is a note, and one is by the person telling you specifically. And because we were able to make these very unique connections, we were able to hear these stories and recognize that there was a need for a co-occurring response. This is not just substance use anymore. We're seeing the growth, we're seeing the need, and we need to address it. We worked very closely with our Department of Mental Health to refer just about every single individual that we encountered that needed, that potentially would benefit from services, and that was incredible. And the Department of Mental Health took every single referral, followed up with incredible care and ease, but still we started to see that there was a gap. Because a lot of times we have information, phone numbers, addresses, and that information doesn't, the individual isn't always able to be located. And so in partnering again with the Department of Mental Health, we designed and thought how can we do this better? And so I'm showing you right now up on the screen, this is our 2023 COPS grant. It's a CIT team. The team is to support and advocate through Frontline Engagement. It is the SAFE team. This team will be making first touch encounters. They will be connecting, assessing, and referring. We are not replicating anything that already exists in the community. We are literally just taking our resources to be able to connect with more individuals in the community so that we can get them into, assess their needs and refer them for services. As you can see, law enforcement is still responding to behavioral health calls. They're coming in through the 911 center. There were, since 2018, 2,340 911 calls that came in, and that were deemed behavioral health encounters. We saw between 2021 and 2022 a 28% increase, just as we saw with our intentional versus non-intentional overdose. So the need was there. So with this, we're going to be replicating and expanding our Oracle model to increase our capacity for a county-wide response to intentional overdose and behavioral health calls. And I'm going to turn this over to Lieutenant Chad Story. He's going to talk a little bit about the CIT aspect of this team, talk about the co-response, how we're developing community partnerships, and implementing this response.